as Judex, and I'm here today to interview the causes of brain damage, the symptoms, and the cure to it. But before we go move straightly to the meaning of brain damage, I would like you to know that brain damage can also be referred to as brain death or brain loss. When we say brain damage, it simply means brain death or you say brain loss. And this could be explained as the total and irreversible loss of our brain functions and the circumstances under which the donation of vital organs most commonly takes place. It could also be explained as the destruction, deterioration, or degeneration of brain cells. That is, when the brain loses all its ability to perform its task, the brain is said to have been affected. Brain death occurs when a person has an irreversible catastrophic brain injury, which causes total cessation of all brainstem functions. That is, it occurs due to a wide range of conditions, illnesses, or injuries. Now, what are the causes? The possible and common causes of brain death are trauma to the brain, that is, severe head injury caused by a motor vehicle crash, fall or blow to the head. Then, cerebrovascular injury can cause brain death, that is, stroke or aneurysm. Another major thing that can cause brain death or brain loss is anoxia. Anoxia, that is, lack of blood flow containing oxygen to the brain. And that thing that can cause is brain tumor, poisoning, infection, and neurological illness. So these are the things, there are the causes of brain loss to mankind. Now let's share my light on the traumatic causes of brain injury. All traumatic brain injuries are head injuries, but head injury is not necessarily brain injury. What we're trying to say is not all head injuries are brain injuries. But there are two types of brain injury, which is the traumatic brain injury and the acquired brain injury. Both the traumatic brain injury and the acquired brain injury disrupt the brain's normal functioning. But when we're referring to traumatic brain injury, which is the TBI, the traumatic brain injury is caused by an external force such as blow to the head that causes the brain to move inside the skull or damages the skull, which in turn damages the brain. But in the case of acquired brain injury, ABI, it occurs at the cellular level, and it is most often associated with pressure on the brain. This could come from a tumor, or it could result from neurological illness, as in the case of a stroke. But take note that both traumatic and acquired brain injury occur after birth, and neither is degenerative. That is what we're trying to say is both the acquired brain injury and the traumatic brain injury, they both occur after birth, not before birth. Not before birth, but after birth. Now, let's outline the causes of traumatic brain injury. One can acquire a traumatic brain injury through car accidents. When you have an accident, it can lead to brain loss. Blows to the head can lead to. Sports injuries can lead to. Falls. Physical violence. These are the kind of things, these are the things that can lead to traumatic brain injury. But in the case of acquired, they could be caused by poisoning or exposure to toxic substances. That is when your food or drinks are exposed to toxic substances. That is when you are poisoned. It could lead to acquired brain injury. Infection could lead to acquired brain injury. Strangulation, choking, or drowning can lead to acquired brain injury, stroke, heart attacks, tumors, aneurysms, neurological illnesses, and abuse of illegal drugs. These are the things that can lead to acquired brain injury. When you use drugs illegally, it could lead to brain loss. What are the symptoms of brain damage? There are numerous symptoms of brain damage, whether traumatic or acquired. They fall into four major categories. We have the cognitive symptoms of brain damage, perceptual symptoms of brain damage, physical symptoms of brain damage, then behavioral or emotional symptoms of brain damage. But they are listed below. These are the out list. We have difficulty processing information. These are the signs, symptoms to tell you that it could lead to memory loss or brain loss. Difficulty in expressing thoughts could lead to brain loss. Difficulty understanding others, shortened attention span, inability to understand abstract concepts, impaired decision-making ability, memory loss, change in vision, hearing, or sense of touch, spatial disorientation, inability to sense time, disorders of smell and taste. These are the symptoms of brain damage. Balance issues, persistent headaches, extreme mental fatigue, extreme physical fatigue, paralysis, tremors, sensitivity to light, sleep disorders. These are the symptoms. When you are seeing these kind of signs in your body, just know that this could lead to brain damage. Irritability and impatience, reduced tolerance for stress, sluggishness, increased aggressiveness, and so on. These are the symptoms of brain loss, of brain damage. Now, what are the treatments or cure? Anyone who has a head of brain injury needs immediate medical attention. Brain injury does not necessarily result in long-term disability or impairment, but a correct diagnosis and treatment is needed to contain or minimize the damage. The extent and effect of brain damage is determined by a neurological exam, neuroimaging testing, such as MRI or CT scans, and neuropsychological assessment. Doctors will stabilize the patient to prevent further injury, ensure blood and oxygen are flowing properly to the brain, and ensure that the blood pressure is controlled. Almost all patients will benefit from rehabilitation to assist in long-term recovery. That may include physical therapy, occupational therapy, speech and language therapy, psychological support. So these are the treatment or cure to brain damage, brain death, or brain loss. So whenever anyone is having this kind of ailment, he or she can be displayed to physical therapy, occupational therapy, speech and language therapy, and psychological support. Can brain injuries be prevented? There is a serious question that have to be solved. Most injuries that cause brain damage are preventable, but there are some rules to follow to reduce the risk of brain damage. There are some things you have to put in order. There are some things you have to consider to prevent brain injuries, which is never shake a child. It is unlawful. It is medically inappropriate to shake a child or an infant. Ensure to wear helmet during sports or cycling. Wear seat belts in cars and drive carefully. Whenever you're driving, ensure you wear your seat belt. Avoid falls by using a steep stool when reaching for high items. Don't use illegal drugs. Illegal drugs often lead to brain damage. Avoid using illegal drugs. Then whenever you want to drink alcohol, Drink only in moderation and never drink and drive. So these are the ways